Solution-Focused Therapy. Group 3. Elizabeth Best, Kelly McKay, Stephanie Suarez. Solution-focused therapy springs from postmodern social constructionism that posits that reality is not objective, that we can never know another's reality. Language creates our personal meaning to the world around us. Tenets and principles. If it isn't broken, don't fix it. Solution Focus believes, if it works, do more of it. If it's not working, do something different. Solution language is different than problem language. Small steps can lead to big changes. A solution is not necessarily related to the problem. Solution Focus values the client as the expert. The client is the expert of his own life. All clients and client systems possess intrinsic strengths that can be cultivated to increase motivation and to form solutions. The therapist's approach. Therapists utilize a stance of not knowing and leading from behind, exercising a perspective of genuine wonder and curiosity, employing empathetic, non-judgmental, and blameless attitude. Intervention is brief, goal-oriented, and solution-based. Therapeutic techniques are geared towards cooperative exploration of the client's strengths upon which to build solutions. The focus is on exceptions and possibilities. Techniques and phases. While in the problem phase, the therapist will work with the client to seek clarification by defining who, what, where, when, and how. Here, the therapist engages the client into building a rapport and showing client genuine empathy. The assessment phase. While in the assessment phase, the therapist uses the miracle question by eliciting details, exploring client meanings, and using relationship questions to develop well-formed goals. The intervention phase. Here, the therapist uses the exception question to explore what strengths the client has already implemented and what times did the problem not exist. The bridging phase. Here, the therapist bridges what the client and therapist have uncovered about client strengths and solutions with behavioral and observational tasks in which the client will engage. Follow-up and evaluation phase. In the second session, the therapist would explore and evaluate what's better for the client. Research and core knowledge. Research and core knowledge. Solution-focused therapy consistently exhibits positive outcomes for diverse settings, diverse diagnoses, diverse cultures, and populations. Solution-focused therapy consistently exhibits equal or more positive outcomes compared to other therapeutic modes. Applicable settings. On a micro level, solution-focused therapy can be used in therapeutic sessions with individuals, groups, families who may be suffering from addiction, trauma, domestic violence, or in crisis response. On a meso level, solution-focused principles and techniques may be used in academic settings such as classroom behavioral management, school counseling, or at a corporate level, in agencies consulting for restructuring, management training, personal management, or possibly team building. At a macro level, solution focus can be used in criminal justice or by developing social policy.
Da na 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 da na 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 da na 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 dum 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 dum.
Technique demonstration. Miracle question and rationale. Client description. Our group has chosen to demonstrate how the miracle question is utilized in solution-focused therapy. Here, the therapist invites the client to engage in imaginative exploration of possibilities. In this way, the client discovers what's important to them. Together, the client and therapist collaborate to develop well-formed goals. Client description. Tanya is a 30-year-old Native American female who has just lost her home to a fire. She has a full-time job and attends classes at the local college in the evenings. Tanya, her spouse, and daughter are currently staying with extended family. Tanya has chosen to seek counseling due to her feelings of being overwhelmed and stressed. The miracle starts here.